The junior senator from Iowa.
Thank you, Madam President. The so-called Right to Contraception Act goes far beyond the scope of providing access to contraception. It's important the American people understand what the Democrats are peddling. Senator Markey's bill creates a precedent to mandate access to abortion drugs for women and girls of all ages. It also allows taxpayer dollars to be funneled to organizations like Planned Parenthood. The bill removes conscious freedom protections, which allow our doctors and nurses to maintain their religious and moral beliefs while practicing medicine, a right that we are all afforded in the workplace, which should be upheld. I would like to remind my Democrat colleagues of the Religious Freedom Restoration Act, or RFRA is what we call it here. It is a law that was championed by Senator Chuck Schumer more than 30 years ago. The majority leader has really come a long way, hasn't he? Just like President Biden, who used to be pro-life. Religious professionals and organizations across the country rely on RFRA for protection from broad government overreach. Yet the Democrats are willing to upend that precedent for politics and, more importantly, for abortion. Let's be clear what's going on here. From the Senate to the White House, Democrats do not have anything to run on, no agenda that resonates with the American people. So instead, they are fear-mongering in the name of politics. Fortunately, Republicans have a solution: the Allowing Greater Access to Safe and Effective Contraception Act. Like 90% of Americans, I believe routine use contraception should be safe and accessible. That's why I've long worked to increase access to safe and effective over-the-counter oral contraceptives. With my bill, we're ensuring women 18 and over can walk into any pharmacy, whether in Red Oak, Iowa, or Washington, D.C., and purchase a safe and effective birth control option. This Republican bill creates a priority review designation for over-the-counter birth control options to encourage the FDA to act quickly. I am encouraged that as of this year, the first, but the only, over-the-counter option on the market has been approved. But having just one over-the-counter product on the market is just a starting point. We need more options that are truly effective for women, women in rural areas, women facing domestic violence. In addition, my bill brings much-needed transparency and accountability in federal spending to better understand where gaps are occurring, and also to ensure dollars are actually going to supporting women and families. GAO will take a 15-year look back at total dollar amounts for contraception reimbursement, inventory stocking, provider training, and patient education efforts to help better inform us as lawmakers and you as taxpayers on where and how our money is being spent. Madam President, I ask unanimous consent that the Senate proceed to the immediate consideration of calendar number 418 as 4447. Further, that the bill be considered read a third time and placed and passed, and the motion to reconsider be considered made and laid upon the table with no intervening action or debate.
Is there objection?
Madam President.
The junior senator from Minnesota.
Reserving the right to object. I have great respect for my colleague from Iowa, our neighbor to the south, but we just disagree on this issue. Madam President, I think that this is an attempt by Republicans to claim that they are increasing access to contraception when, in fact, this bill does not accomplish that goal at all. And I also think that our Republican colleagues believe that they have a message problem when it comes to women's health, when in fact they have a policy problem. And I regret to say that this bill is not going to fix it. 1 in 3 women in this country face barriers to accessing prescription contraception, and only half of women that are interested in over-the-counter birth control pills can afford them. But instead of addressing this very real and very well understood challenge, this bill does nothing to improve access to contraception. It does not address the lack of insurance coverage for prescription and over-the-counter birth control, carve-outs that Republicans have repeatedly supported, which makes contraception more expensive for patients. It does not protect patients from efforts to roll back the ability of providers to prescribe birth control. It does not enable patients to know what's best for themselves to get birth control without unnecessary barriers. Instead, the bill directs the FDA to prioritize the review of applications to convert prescription contraception to over-the-counter. But in fact, an over-the-counter birth control pill has been approved for almost a year and has been available in stores since March of this year. And this bill does nothing to get that product into patients' hands. In fact, it explicitly restricts access to this important product for young people. This bill also directs a study of federal funding for contraception. Madam President, we don't need a study to tell us that there are problems here. We know what the problem is. We know that President Trump's anti-abortion justices at the Supreme Court and Republicans' years of policies here in Congress and in state legislatures around the country have restricted access to birth control. In addition, this bill reinforces the misguided view that emergency contraception causes abortion. That is not what the science says, and it is not what doctors say. If Republicans truly support increased access and fewer barriers to contraception, then they should vote for the Right to Contraception Act. Our bill would actually guarantee the right for people to obtain and use contraceptives, and for health providers to provide contraception information, all free from government interference. The Right to Contraception Act is the bill that we all need to support, and I look forward to voting for this bill this afternoon. And for these reasons, I object.
Objection is heard.
Madam President.
The junior senator from Iowa.
Madam President, I am disheartened to see my colleague from Minnesota rise in opposition. I respect her greatly as well, and we do disagree on this issue. But unfortunately, given the nature of this political exercise, I'm not surprised. This was never about finding real solutions. This was always about fear-mongering and election year stunts. My effort, one that many of my Republican colleagues support, is a common-sense solution to give women more access to over-the-counter birth control options and bring accountability to government spending. Not about finding loopholes so we can find a way to fund those drugs that cause abortions. Despite attacks from the same far left that promotes drugs that endanger women and encourages the death of the unborn, I will always stand up for families. And as a mother and a grandmother, alongside my fellow Republican senators, I will continue to protect life while supporting policies that equip women to raise children to live the American dream. Thank you, Madam President.